Jordan Heimerman, and this is my final presentation over SHIP, Kansas Small Hospital Improvement Program. SHIP is a specific type of grant given by the organization KRHOP, or Kansas Rural Hospitals Optimizing Performance. This organization is known for offering technical support, information, networking opportunities, and funding and other resources to critical access hospitals and other rural providers. The SHIP grant specifically within this organization supports small rural hospitals with activities related to quality improvement and improved use of health information technology. On top of the SHIP grants, a new addition to the grant has been COVID funding. So the Health Resources and Services Administration has provided extra one-time funding to help hospitals prevent, prepare for, and respond to COVID-related emergencies. This funding helps hospitals ensure that they are safe for staff and patients. They help detect, prevent, diagnose, and treat COVID-19 patients, and they help maintain overall hospital operation. One of the requirements of SHIP, which will be discussed later, is quality improvement reporting. COVID has also added more of a grace period on the timeline for reporting these quality improvement scores. This grant does help fund many hospitals in the area that I am currently in. The city itself, which I am in Hays, Kansas, has a large hospital where critical access hospitals often send their patients, so we do not get funding from SHIP. However, places like Plainville, Russell, or La Crosse, which are only about 30 minutes away from Hays, are critical access smaller hospitals and so do receive funding or are eligible to receive funding. Here is an easy-to-read map displaying all of the critical access hospitals around the state of Kansas, which was last updated in 2013. Many of these hospitals are in western Kansas, which does make sense because as you go east, you get into the bigger cities such as Wichita and Kansas City. In order to receive funding from this grant, a hospital must be defined as a critical access hospital. A critical access hospital has these features: having 49 available beds or less, located in a rural area, which is defined as being outside of a metropolitan statistical area, and it is defined as a non-federal, short-term, general acute care facility. My facility at Hays Medical Center exceeds these criteria by quite a bit. The acute care unit alone has 46 beds. This does not include labor and delivery, surgery, PCU, progressive care, ICU, bone, joint, and spine, and ambulatory care, not including all of the clinics that Hays Medical Center provides as well. Because of this fact, if I were wanting to do a project out in western Kansas, I would have to choose a different hospital compared to my own healthcare facility if I wanted to receive funding from this grant. From this grant, hospitals receive direct grant funds ranging between $8,000 and $10,000. SHIP funds can be used for hardware, training, education, software, and technical assistance, including overall quality improvement. SHIP funds cannot be used for travel, direct patient care, hospital inventory, or employee salaries. Some other improvements that this grant helps achieve include improving data collection activities in order to facilitate reporting to Hospital Compare, maintaining accurate billing and coding systems, building accountability across the continuum of care and improving overall care transitions, and improving overall quality outcomes, including reduction of medical errors, as well as education and training in data collection and reporting and benchmarking. This grant does require quality improvement score reporting. However, there is not a specific score that has to be achieved. The most recent timeline for this grant started in June 2020 and ends in May of 2021. This grant does renew yearly. If I were to do my project at a rural hospital, it could potentially line up with my project if I were to find the exact date that I needed to apply each year. This grant also includes required report dates for the quality improvement scores. The most recent reports are quarterly, so they were done October through December, January through March, April through June, and July through September. While I have not decided on a research topic at this time, I am interested in possible cardiology or stroke possible education. This could be potential if the research was used for quality improvement for that hospital. The SHIP grant does not specify whether they provide funding for school research projects that would be applied in a clinic or hospital setting. I would, however, have to choose a different facility as my current place of work, Hayes Medical Center, is not considered a critical access hospital.